Hello dear friends, this is a case of a male patient, 77-year-old, who presented with acute abdomen, significant abdominal pain, generalized tenderness, distended and hard abdomen, elevated lactate 4.4, and bowel obstruction was suspected, and further evaluation with a CT scan was done. So let's have a first look in the abdomen. As you can see, there is significant dilatation of the whole small and almost all the large bowel. Okay, now let's see some details here. There is significant fecal loading of the large bowel. Here is the right colon. Let's track the gastrointestinal tract, the large bowel. We can see that there is significant fecal loading. There are some air fluid levels here and there, suggestive of a degree of obstruction. Fecal loading in the descending colon as well. Unfortunately, there are some hardening artifacts due to previous surgery, right-sided hip arthroplasty, but we must try to find the cause of this appearance, of this significant dilatation. So let's go directly to the point. As a general rule, it's very important to start from anorectal region. It's very important to see if the rectum is empty or it is full of feces. And anyway, and despite the fact that there are some artifacts here, we can see that the rectum is not dilated. Actually, it's collapsed. Okay. There are some feces, of course, some gas, but it's not pathologically dilated. Let's go a little up, further up, and let's have a look. Here it is. Okay, it is collapsed right here. It's very important finding, and let's track it up. Once again, up and down. Try to track the gastrointestinal tract. Here it is. Here is the rectosigmoid transition, and we can see that there is significant wall thickening in this region. The bowel here is collapsed. Here is wall thickening, which is continuous up to that point. It is circumferential, and proximally to that point, the dilatation of the large bowel starts. So here it is dilated. Okay, let's go again back, and we can see the site of the obstruction. So this is highly suspicious, if not certain, that this is a colonic tumor. Okay, let's have a look in coronal view now. Here is the level of the upper rectum, which is collapsed. So let's try to track the images. Here it is, here it is, here, here. Okay, and here we can see the difference, the transition. All this is the wall. There is circumferential wall thickening at this point. Once again, here it is. Here, let's go up. Okay, here is the circumferential wall thickening, irregularity, the transitional point, the stenosis, and here the dilatation of the large bowel starts. It goes down here. Unfortunately, the hardening artifacts do not allow full assessment of the region, but anyway, we are very lucky that we can see the colonic tumor here. So this was a good example to learn how to track the gastrointestinal tract. Once again, here is the colonic pathology. Here is the transitional point. Okay. It is very good idea to see the sagittal view as well. We can see that the rectum, the anorectal region, does not show any pathological dilatation, and at this point we can see the colonic tumor, circumferential wall thickening, the transitional point, and from that point here, this point, the dilatation starts. So this is a large bowel obstruction due to a colonic tumor. Let's have a general look now. As you can see, the small and the large bowel are significantly dilated. Another interesting point, probably an incidental finding here, is the proximal jejunum, which is collapsed. Okay, and if we go a little further distally and follow the jejunum, here it is. Okay, and at this point there is an impression that there is a small prolapse and another transitional point, okay, from stenosis to dilatation. Probably this is a small intussusception. There is no pre-stenotic dilatation, there is metastenotic, post-stenotic dilatation of the small bowel here. So probably this is an incidental finding, okay, a small intussusception. This is a possible diagnosis anyway. Let's go back to the major finding here. This is the colonic tumor once again. Dear friends, thank you for watching. If you find my videos interesting and tutorial, you can consider to subscribe to my channel so you'll be notified the next time I upload a new interesting video to my channel. See you the next time soon.